Om Swastiastu. Good morning, Doctor. We are from small group discussion B2. Today we will present our student project with the title Marine Animal Bites in Children. Before we start our presentation, we will introduce ourselves. Next slide. The member's name and the student numbers can be seen on the slide. Next slide. Okay, now we will start our presentation from the background that will be presented by my friend.
Good morning, everyone. My name is Nirajanari with the last three digits of my student number are 063. Today, I would like to present about the background of our paper. Marine animals are an integral part of the marine ecosystem. Some of these marine animals are known to have poison or venom in their bodies as a form of self-defense against predators. If we are not careful, we can get bitten by marine animals. Open wounds caused by bites of marine animals, both venomous and non-venomous, have the potential to become seriously infected due to the presence of unique aquatic microorganisms. The serious health risks due to bites by marine animals, followed by literatures that discusses the bites of marine animals and the handling that must be done when bitten by these animals. Encourages the authors to study and write more deeply about the bites of marine animals. That's all for me. Thank you.
Okay, so let me introduce myself first. My name is Nengah Pedoman with three last digit number is 051. And from problem formulation, there are 5 problem formulation. The first one is what are the types of marine animals? The second one is what are the effects and symptoms that can be caused by marine animal bites? The third one is what are the treatments for marine animal bites? The fourth one is what kind of medicine that can be given to the patient. And the last one is how to prevent the marine animal bites. And from the objectives, there are 5 points. For the first one is to find out explanations about the different types of marine animals and then to know what are the effects and symptoms that caused by marine animal bites. The third one is to find out what we can do as a form of treatment for patients, and then to know the type of medicine that can be given to the patients. And the last one is to know the preventive ways to avoid marine animal bites. And that's all from me. Will be continued with my friend. Thank you.
Hello everyone, my name is Ketut Uttami and my last three number is 048, and today I will tell you about the benefits of this student project. First, the theoretical benefit. The student project used as a source of information regarding venomous and non-venomous marine animal and its effect on the children when they get bitten. It also mentioned about the treatment, the medicine, and also how to prevent marine animal bites. Next is expected to deepen knowledge about both venomous and non-venomous marine animal bites. Also, practical benefit is used as a source of information and also a reference about venomous and non-venomous marine animal bites, besides from gaining experience as well as knowledge of the writers in writing scientific works. The student project also expected to be used by other academic institutions as a reference to improving or developing the effects and also the treatments of the marine animal bites. That's all for me. The next slide will be presented by my friend.
Okay, I will continue the presentation. My name is Putu Ari Apsari, with the last three digits of my student number are 058. Venomous animals produce specific toxic substances that can be injected into their foods by applying their venom with a tool such as a tooth and stinger. There are more than 1,200 venomous fish in the ocean, such as octopus, lionfish, and jellyfish. The symptoms caused after the attack will be different for each type of animal. A few minutes of inflammation, the toxic can be affect the nervous system and causing cardiac arrest, paralysis, vomiting, spasm, shock, and death. That's all from me. Thank you.
Okay, I will continue the presentation. Hello, doctors and friends. My name is Teresa Vitania Amaris, with the last three digits of my student number are 060. I will continue the presentation with the subtitle Non-Venomous Marine Animal. So while some marine animals are extremely venomous, there are also some creatures that don't have any poison, but still some of them are dangerous. They might not cause any anaphylactic, but still can harm us if getting bitten or struck. Dolphin, sea lion, and orca are some marine animals we generally know as non-venomous. Surprisingly, orca, which has been worldwide labeled as fierce predators, are generally not dangerous to humans. In fact, there have been very few recorded instances of orca attacking or harming humans in the wild. On the other hand, sharks are the ones who often threaten humans. It has been reported that there are 57 confirmed, unproved shark attacks worldwide. But still, how bad the shark attack is, they are non-venomous marine animals, as well as some other fishes. That's all from me. Thank you.
Okay, I will continue. My name is Putu Pranadea Sagara with the last three digits of my student number are 059. And now I will explain about the effects and symptoms that occur from marine animal bites. So, marine animal bites can result in the onset of wounds, active bleeding, poisoning, significant tissue injury, increase the likelihood of infection by waterborne organisms, even being able to cause death. Wounds arising from marine animal bites will vary, depending on the types of animal. Barracuda bites or fish with sharp teeth will cause sliding wounds. Sea eel bites will cause severe lacerations and deep puncture wounds. Shark bites mostly result in minor injuries, such as puncture wounds and linear lacerations. But there are also shark bites that cause long and large lacerations more than 20 cm, tissue damage, limb loss, exsanguinating bleeding, even death. That's all for me. Thank you.
Hello everyone, my name is Dinaria Sakura Kirani. The last three digits of my student number is 055, and I will present to you the effect and symptoms of transmitted microorganism and toxicity in marine animal bites. The first one, there are transmitted microorganism infections that could cause the gastrointestinal problem that caused by fibrous species and aeromonas species that transmit through fish and marine reptile bites. The second case is infections of Mycoplasma phocacerebri that could cause by seal or sea lion's bite that leads to severe painful swelling effect but without abscess or signs of infections. The third case is what's accompanied by toxicity effect that could cause by sea snakes bite. Okay, that's all from me. The presentations will be continued by my partner. Thank you.
Hello, my name is Gede Pramaditya by Saputra, and the last three digits of my student numbers are 045. I'm going to explain how to treat the venomous marine animal bites. There are 4 points, main points. There are get the victim away from the animal, assess the airway, breathing, and circulation of the patient, and don't forget to control the bleeding. Obtain an accurate history of how the patient got the bite and remove the stringer, cover the wound, but not entirely. That's all for me. Thank you.
Okay, hello everyone. My name is Putu Ari Nirajanari, and the last three digits of my student numbers are 049. I'm here about to explain about the treatment of non-venomous marine animal bites. Bites from non-venomous marine animals usually cause mechanical trauma or open wounds. First thing to do is to focus on stabilizing the wound. This can be done by covering the wound with a cloth and pressing it firmly to avoid losing too much blood. In dealing with obstructive bite wounds, in the treatment, patients are strongly advised to be directly referred to the nearest hospital or for further treatment such as surgery and everything that a doctor will suggest. That's all that I can say. Thank you for the time. The next slide will be present by my friend. Thank you.
Hello everyone, my name is Kadek Putri with my last 4 digits and my student number is 056, and I'll explain about the medicine of the marine animal bites in children. The type of the drugs that could be used is analgesics, and the first type is paracetamol or acetaminophen. This type of drug is used for mild to moderate pain, moderate to severe pain, and temporary reduction of fever, and the dose is 15 milligrams per kilogram every 6 hours up to 60 milligrams per kilogram per day. The next type of analgesics is NSAID. It's a non-steroidal anti-inflammatory drugs to treat mild to moderate pain, inflammatory process, and temporary reduction of fever. The type of the drugs of NSAID is aspirin, and the dose for children up to 12 years and adolescents weighing up to 50 kilograms is 325 to 500 milligrams every 4 to 6 hours. And the next type is ibuprofen, and the dose for children is 10 milligrams per kilogram every 6 to 8 hours, and cumulative daily dose should not exceed 30 milligrams per kilogram. The next one is trimethoprim or sulfamethoxazole. This type of drug is antibiotics, and the dose for children weighing 40 kilograms or more should have a single tablet of 800 milligrams for sulfamethoxazole and 160 milligrams for trimethoprim every 12 hours or 10 to 14 days. The next one is an anti-snake venom or ASP, and the dose is 1 vial of ASP was reconstituted to 10 milliliter with sterile water for injection. Intravenous usual dose 10 vials in 500 milliliter of normal saline with constant rate over a period of 1 hour is given without any prior sensitivity testing. That's all from me, and the next slide will be presented by my friend. Thank you.
Okay, thank you so much for the opportunity that I have today. So before that, let me introduce myself. My name is Putri. My last 3 digits of my student number is 067. So today I'm going to explain about the prevention of the marine bites in children. So first is the important things, or the most important thing is to find out which marine species that are prevalent to the place that you're going to go with your children. So prevention, especially this is for the jellyfish bites that I find some of the journals, but it also can be in a common prevention for prevent the marine bites on children. So first is do not swim if there are any reports of any jellyfish or marine that can bite your children. Second, to use lotion for the protection. There are specifically a lotion that can use for the protection for the children from marine bites. And the last one is put on safety suit. So make sure that your children use the safety suit that can prevent them from any bites from marine animals. And other than that is also to make sure that to make sure that your children have a good immunization, so it can be a point plus for prevent any bites from marine animals. So that's all from me. Thank you so much, and I will let my friend to be the next one. Thank you.
Okay, my name is Made Prema Pratnya Prasanti. With the last 3 digits of my student number are 064. I will continue the presentation with conclusion. So based on what has been discussed, this group can conclude that there are 2 types of marine animal bites in children, such as venomous and non-venomous marine animal bites. Marine animal bites can lead to the onset of wounds, active bleeding, poisoning, significant tissue injury, increase the risk of infection by waterborne organism, and can even cause death. There are several treatments that must be done to treat venomous marine animal bites and non-venomous marine animal bites. The treatment of marine animal bites requires several drugs, such as paracetamol, non-steroidal anti-inflammatory drugs, antibiotics, antivenom, and etc. There are some important precautions to take to protect children from marine animal bites. Next slide. Okay, that's all from our presentation. Thank you for listening, and we are sorry if there are mistakes during our presentation. We close this presentation with Parma Santi. Om Santi, Santi, Santi Om.